Namaskar, I am Dr. Sanchan Mandal. I am Senior Consultant Medical Oncologist. I am practicing in HCG, Kolkata, Newtown. Today is the very important topic to discuss about. It is the lung cancer awareness. So, as I can tell you that lung cancer is prevailing not only in India, it is over the world. It is prevailing. It comes within the first three cancer in the world and India, and both incidence wise and mortality. That means the rate of patient death after diagnosis of cancer. So it is very important to know about the lung cancer, the basic symptoms and signs that are alarming, that you all should know about the lung cancer. That is that it starts with the cough. With cough, it may, sometimes patient present with hemoptysis in medical term. It is called in colloquial language blooding of cough. Or sometimes patient presented with chest pain when there is a large size of mass compressing the chest wall or backside of the bone. That is the localized or locally advanced symptoms. And sometimes patient presented with weight loss, also having anorexia, weight loss, that's now, lung cancer sometimes to the other side of the body, that is in medical term called metastasis. And this stage of this cancer is called stage 4 cancer, a very advanced stage of cancer. In these types of presentation, the patient may present with additional symptoms and alarming signs that you all should know and get counseled or get the medical oncologist opinion as soon as possible. If the patient lung cancer spread to the brain or head, then the patient may complaining of headache, nausea, vomiting, or double vision of the eye. If the patients have the pleural effusion or the our fluid collection on the outer side of the lung, that is called in the pleural cavity, then is called pleural effusion. Then may patient complaining of excessive shortness of breath and pain in the chest. If the patient has a metastasis in the liver, then the patient may complaining of abdominal pain, or sometimes in more advanced cases, patient may have raised bilirubin level also. And also patient presented with bone pain when there is a metastasis to the bone also. So this is the alarming sign and symptoms that initially patient presents. And when we see as a medical oncologist, when we see the patients, we actually try to analyze what are the problem, what are the staging of the disease, what is the diagnosis of the cancer. And currently in current guideline, there is a no role of FNAC that some oncologist or some previous senior physicians or do FNAC based therapy. Now the paradigm of the treatment is almost changed. Now all the diagnosis depend on the core needle biopsy, because in core needle biopsy more tissue is available, and now the even the stage 4 lung cancer we have the option of immunotherapy, targeted therapy, so that we can using this agent to increase the survival of the patient. And for the knowing the which agent to use, like immunotherapy or targeted therapy, we have to do some tests to know the marker expressions or the marker expressions in the patient body, or the immunotherapy expressions marker inside the patient's body or tumor cells. That we all have to know before giving this advanced form of therapy to increase the survival of the patient. In imaging studies, we often do the PET CT scan of the whole body to know whether the patients presented with localized disease, locally advanced disease, and metastasis disease. In case of the patient present with localized disease, very localized disease, their options are surgery. After surgery, we have the options of radiotherapy and also targeted therapy or immunotherapy as the adjuvant therapy after surgery therapy. Now data has come, and it shows there is increasing metastatic-free survival, recurrence-free survival in the patients. Now, this tissue biopsy divided into the small cell carcinoma and non-small cell carcinoma. If the patient presented with the small cell carcinoma, localized disease, then we have the option of concurrent chemoradiation. If the patient presented with extensive stage small cell cancer, and then we have the option of immunotherapy, chemotherapy combination to increase the survival of the patient. Whereas in non-small cell carcinoma, we have the option of surgery, radiation therapy, chemotherapy, and in localized stage, I already told, in locally advanced stages where the surgery is not possible, we have the option of concurrent chemoradiation. followed by immunotherapy or targeted therapy as a maintenance therapy. In stage 4 therapy, stage 4 disease, as I has already discussed, that there is an option for targeted therapy and immunotherapy that we often see in the tissue block, that what are the markers of expressions of positive, like EGFR, AL cross, what are the type of mutation is happening in the tumor. And according to this expression, we actually decide what form of targeted therapy is applicable for the patient. And in our practice, we have seen with the use of this targeted therapy, immunotherapy, we actually increase the survival of the patient. And not only that, we actually maintain the quality of the patient, quality of life of the patient, so that the patient have their day-to-day normal lifestyle in a good quality of life, just like a healthy person, and continue the advanced form of therapy. And there is also increase of survival chance. Recently, there are some targeted mutations, the targeted therapy results come that shows there is a very good at around 5 years progression free survival is very good, robust. So it is a very promising to treat the patient also. And as the clinician is also very that keep a smile on our face, that even we treat the last stage of the disease of the patient, we can have a smile in the patient because we are controlling the disease for a long time. So stage 4 patients where the progression free survival 5 years is very good is a very huge number. And it is also sympathetically and passionately for the family member also, those who are actually draining their money on financial burden they are keeping to keep the patient alive. So these are the basically the advanced form of therapy, the diagnosis, the treatment part, the symptoms and signs that are all has been discussed. Last but not the least, what are the risk factors for lung cancer that I often see that our youngsters, the college goers, are heavily addicted to smoking, and this is the main culprits. This smoking tobacco in form of cigarettes or bidi. This is the main culprit of causing the lung cancer. Although there are some occupational hazards are also there, those who are actually working in the uranium mines, or those who are working in the radon gas or radon mine, or those who have the exposure in asbestos industries, they have the propensity for occupational hazards for development of the lung cancer. And sometimes female presented with lung cancer, they often have a poor ventilation in the cooking area or the kitchen, and that might lead to the or the poor the chulla type where they have to give a blow to the to increase the gas or increase the cooking. This type of unhygienic or the pores ventilated kitchen that may cause female adenocarcinoma, mainly to the lungs also. So non-small cell carcinoma largely divided into adenocarcinoma, large cell carcinoma, and squamous cell carcinoma. So I think this is the gist of that cancer diagnosis that I actually give you a little bit of what are the main risk factors, what are the signs and symptoms, what is the diagnosis, what are the latest treatment, and what is the survival. If you have any further questions, don't hesitate to ask me. I'll be more than happy to help you. So keeping my talk today right now here, all keep yourself busy and avoid smoking. Namaskar and have a nice